Murakoze nawe, Ambassador Murakoze Chan. Now, the last few years have really tried and tested Africa's healthcare systems. A focal organization has been Africa CDC, and I know the mandate placed on Africa CDC has been huge. Who best, before we get into the conversation on accessibility of healthcare provision across different communities, who best to speak than Dr. Jean Kaseya, who's the Director General to Africa CDC?
Good morning. I was here 2 weeks ago. I was using papers. They say, no, this is a digital meeting. You must use a digital tool. This is why I'm using that. My dear brother, Dr. Sabin, the Minister of Health, Rwanda, let me recognize also your twin sister, Minister Paula. I think both of you are doing an amazing job here. We'll talk about it. Let me recognize also our sisters who came from Uganda and Malawi. They are deputy minister and state minister from Uganda and Malawi. I think people, they will know you. We need to recognize you. My friend, Ambassador Belen, from European Union to Rwanda, I enjoy all discussions that we have when we have to discuss about not only the support you are providing to Rwanda, but to the whole continent. Colleagues, dear friends, I think it becomes now a bad habit because my colleagues, they are frustrated. Now, I'm not reading their speeches because every time I have to speak based on what is going on. Today, let me first start by thanking all of you for flying to Rwanda and attending this meeting. Every day, I have to say, with the system in place in Rwanda, there is almost zero risk for Rwanda to spread the Marburg outbreak out of Rwanda. And that one, I made it a few weeks ago. I started to monitor. From that day to date, there were several meetings. I didn't hear someone flying to Rwanda and getting Marburg. Today, let me apologize because our MC said we are late. It's because of me. I apologize. I was engaging G20 Ministers of Finance and Health who are meeting in Brazil. I told them I decided to cancel most of my trips out of Africa to focus on our countries facing outbreaks. And for all of these meetings, I will use the virtual opportunity to engage them. I was telling them, don't apply travel ban. You are not safe because you are applying travel ban. You are safe because Rwanda is doing the great job. And that one, for the country to continue to do the great job, they need $175 million. We don't need your statement. We don't need your verbal support. We need your money to make this country responding to this outbreak and building a resilient system. Believe me, if Rwanda was not doing a great job, we will not be here today. And believe me, this region will be, not only the region, but the continent will be in a mess. Because don't forget, the case fatality in Rwanda is the lowest one if you compare the 10 other outbreaks, Marburg outbreaks that we had in Africa. By commending Rwanda, we are also commending our two champions, Minister Sabin and Minister Paula. When I was here in Rwanda, I had the opportunity to visit the Public Health Emergency Operations Center. I had also opportunity to visit the control room. I was just amazed. I was thinking today under the theme, Innovating for Community Health, Unleashing the Power of Artificial Intelligence. I was thinking it would be around what Rwanda is doing. Colleagues, believe me, it will be a missed opportunity for you if you don't go to visit this control room. I was talking to the two ministers, I was talking to the Inspector General of Police last time, for you to go to visit and to see. That one will help you to know exactly what you need to do for our continent. Don't miss this support fundraising for you, because at the end, it's what all people in this continent and out of the continent are implementing to make the continent moving. This is why I was thinking that you are not today here, you have so many gigs here. I even don't know if I know 10% of what you know. Even I'm struggling with my Samsung to send data to iPhone. You can imagine. But for most of you, it's just a game. But we are here not to talk about our specific product. We are here to talk about a vision. What is the vision that we have for the continent? I will leave you with 3 dreams that I have. These 3 dreams that can take opportunity of the artificial intelligence to support the digital transformative agenda that we launched last year. What is the first dream? Yesterday I was meeting my colleagues from PATH. I think they are somewhere in this room. I was telling them 70% of our outbreaks in Africa are zoonotic outbreaks, worsened by climate change. It means we need a strong One Health approach. Do we have a One Health information management system in Africa? No. If we don't have that, we'll continue to face the same challenge. Then my first dream is, if you can help us to build a One Health information system that can be connected, that can be at national level, but also at continental level, can be the source of information that we need to make appropriate action. My second dream is about how can we have a system from A to Z, what it means. Life starts at maternity and ends at symmetry. From maternity to the symmetry, we want to a conducive environment for you. You need also to enjoy better life with a lot of money that you can build and you can create because you are supported by all of us. These 3 dreams, if you can see, are closely linked, are speaking to my heart as DG, to make sure that the system that we are putting in place can be interconnected, can be efficient, and can help us to prevent this unnecessary outbreaks sometimes we have. If we don't do that, we can continue to have several meetings, will not make progress. I hope next year, when we'll meet again in Kigali, we'll have this system that we can connect not only countries, but also the continent. I thank you.
Thank you very much. Thank you very much, DG. Now, we'd like to get into our first panel for today. I'll call the panelists before we have our presentation. Please allow me to call on stage